all our listeners. Now, back to our show.
And we're back on You and Your Doctor show. We have an action-packed program today. We just had Dr. John Baker on talking about PRP and medical marijuana. And it's hard to believe, but we're back. And Ed Salazar is on the show, Chief Respiratory Therapist, Associate of All County Healthcare Incorporated. We talked a little bit about All County Healthcare Incorporated at the beginning of the show. So they are a home health care agency right here in Palm Beach County, Broward County, and Miami-Dade County. I don't want to forget that. So that Tri-County area, all over South Florida. If you have any questions about home health or how All County Healthcare Incorporated can help you, it's a Medicare certified home health agency. You're going to call Maddie at 954-717-7027. Or you can follow us live right now on Facebook.com/All County Healthcare Incorporated. Like I said, we're lucky to have Ed Salazar here, Chief Respiratory Therapist, and like I said, Associate of All County Healthcare Incorporated. And I actually know a lot about respiratory therapy because my sister is a nurse, registered nurse, and respiratory therapist. So my older sister, Lisa. So I will ask you a little bit more about that, but I want to get right into it. Mr. Salazar, welcome to the program. How are you doing tonight?
Very well, Dave. Thank you. Good to see you again.
It's good to see you again. I'm really excited because I think we all know the acronym COPD, but we have no idea what it is. We've seen the commercial, elephant on the chest. I mean, is that how patients describe it to you? What is it? And does it feel like an elephant on the chest?
Well, most of the times, the patients with some sort of chronic lung disease, and COPD, chronic obstructive pulmonary disease, is one of those. And well, I'll give you an idea. When I was a student, this left an impression on me. Way back in the dark ages, we had an instructor come in one day, and he starts talking to us about what our assignment had been, and while he's talking, he's handing out straws to all the students. So once everybody gets a straw, he says, okay, now I'm going to talk a little bit, but while I'm talking, I want you all to breathe through this straw. Okay.
Okay.
So, we're breathing through this straw, and after a while, we're getting uncomfortable, And he says, how long do you want us to do this? And he said, long enough for you to understand what your patients feel like.
Oh,
when they're having an exacerbation of their COPD. An exacerbation just means like an acute decline in their ability to ventilate themselves.
Like going up a flight of stairs and huffing and puffing at the top.
Yeah, for me, yeah.
Yeah, but even worse for someone with COPD.
Yeah, but it's a very insidious disease. And there's so much of it, especially in South Florida. And the reason that I'm so proud to be associated with All County Healthcare is because they have committed significant resources and personnel to develop a program that is unique among Medicare home health agencies, where they employ a technology called IPV, intrapulmonary percussive ventilation. And what this therapy does is it provides a medicated aerosol to the patient. At the same time, it's doing it's giving them percussive therapy internally, not externally. It is very, very effective. It not only recruits lost lung volume, in other words, parts of the lung that might be collapsed or ventilating inadequately, it'll re-expand those. But in addition to re-expanding, to recruiting that lost lung volume, it also is very, very effective at mobilizing the secretions. Remember, I mentioned that term exacerbation earlier?
Mm-hmm.
Part of what precipitates this exacerbation is, many times these patients are going to have very, very ineffective coughs. Now, all of us with the healthiest lungs, we produce a certain amount of phlegm every day. It's part of the lungs cleansing process. But, it mobilizes, and once in a while we'll cough, we clear our throat and such. But for some of these patients with, very, very advanced COPD, I mean, they can't even cough effectively. So they can't mobilize the secretions they are having. And many times it's also complicated by the fact that they have, this bronchitis, so that the inflammation in their airways is producing even more secretions, and they become very thick. So anything that can help these patients mobilize these is a good thing. The thing that is unique about what All County does, over the last 20 years, there have been millions of dollars invested in developing new drugs, new bronchodilators, medicines to relax the muscle in the airways and open them up, steroids to reduce the inflammation, combination of these drugs. Many, many different formulations have been developed. But in spite of this, there has been no significant improvement in outcomes. One of the things that we want to promote at All County is an educated consumer. Where have you heard that phrase before?
We hear it a lot in the news.
But in terms of being an educated consumer, where it pertains to healthcare, I mean, what could be more important than that?
For sure.
Now, if you're a patient, suffering with COPD, severe COPD, and in spite of trying so many different medications, you're just still having difficulties. Anyone who has been hospitalized 2 or more times in the same year, and the problem is they can't mobilize the secretions. I personally think that they would benefit from something other than a new medication. This IPV is actual physical medicine. It's physical medicine to help them mobilize their secretions, and it works.
Now, let me just hit rewind a second on that. So, as the listeners know, I fell playing basketball a few months ago, and I broke my 5th and 6th rib. So I had to go to the emergency room because it was the worst pain I've ever felt.
That hurt.
Yeah, it was bad. So I have a high pain tolerance, Ed, so this was really bad. So they gave me when I was discharged the breathing apparatus that I had to blow up and down because I had a partially collapsed lung near the bottom rib. It may have punctured it, maybe not, but it was partially collapsed on the bottom. So they gave me that breathing apparatus, and I would blow into it and try to get it up to the 3,000. We've all seen them in the hospital. They put them on the tables when you're there to kind of get the airflow in your lungs so you're not getting pneumonia, right?
Yeah.
So how different, tell me the little difference between that and what IPV actually is. It's a more sophisticated device that someone uses maybe at home to keep from going back to the hospital when their lungs fill with these secretions?
The device that you were talking about is called an incentive spirometer. And actually, it's not blowing into it, it's inhaling.
You're right. I'm sorry, I messed that up. I'm inhaling, trying to get to that high level.
Right, and the idea is to hyperinflate your lungs.
Okay.
To help pop open.
I'm actually sucking the air in, and that prevents from getting the water in the lungs, maybe pneumonia kind of thing down the road, right?
Well, the actual mechanism by which an incentive spirometer works is a little more complicated than that. But basically, what you're trying to do is you're trying to inhale at a high flow rate, and then hyperinflate your lungs, and hopefully open the airways up a little bit.
So what I'm getting to, though, is that kept me from going back and readmitting into the hospital for that particular ailment. Now, your IPV therapy does the same thing. Obviously, it's more sophisticated.
Well, the IPV, what this is going to do is it's going to give the clinician, and in this case, I have trained about half a dozen of the registered nurses at All County Healthcare on how to give a safe and effective IPV treatment. And what the treatment is going to do is it's going to be a 15-20 minute treatment with variable amplitude and frequency. And in other words, the force of the percussion and the frequency of the percussion. It's all variable, and the nurses are going to modulate it to find what is the most effective for that patient, what is the most comfortable for that patient, to do the best combination of helping them mobilize secretions, and facilitate their breathing, and also, prevent pneumonia and lost lung volume.
And in the end, hospital readmission.
Right. One of the reasons that this has done so well for all county, there's a huge incentive right now for hospitals to prevent readmissions for the same diagnosis, and COPD is one of the worst. We were talking about an educated consumer. Anyone in the state of Florida, anyone in the world really, but anyone in the state of Florida can go on the ACA website. And ACA is the regulatory agency for healthcare services in the state of Florida. And on their website, you can look up any hospital in the state of Florida, and you can, evaluate their performance. And you can evaluate their performance specifically to, what the disease condition is that you're concerned with. Obviously, my main concern are pulmonary diseases. So I've studied the readmission rates for COPD, pneumonia, for the last 4 or 5 years since I've been doing this with all county. And it will shock you, but on the statewide average for the state of Florida, and this hasn't changed much. In fact, it got a little bit worse from 4 years ago. But on the average, about 9% of all patients discharged from hospitals in Florida for an exacerbation of their COPD are readmitted within 15 days of discharge for the same problem.
Unbelievable.
I mean, so you can understand why, Medicare is so upset about this.
Ed, hold that thought. We're going to be right back, and we're going to talk a little bit more about ACA. I'm going to give out the website, and you can find out the performance ratings. And we're even going to talk about All County, which has a fantastic 4-star rating on You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back again. We are with Edward J. Salazar, registered respiratory therapist and associate of All County Healthcare Incorporated. We are talking COPD, asthma, cystic fibrosis, and IPV therapies. And right before we broke, we did tell you about ACA and how you can find out about performance ratings. That's the Florida Agency for Healthcare Administration. I want to give out the website. It's ahca.myflorida.com. Tell us a little bit more about it, Ed, and how the ratings come out on home health agencies and why All County has a 4-star rating, in your opinion.
Well, the reason All County has a 4-star rating is because of their outcomes. Medicare, CMS, Centers for Medicare and Medicaid Services, has moving toward an outcomes-driven evaluation system. So the better that the patients perform, the greater the degree to which they improve, then the better the outcome, and the better the rating for the home health agency. It's not, I have trouble. I'm no computer genius, but sometimes I have trouble navigating the websites.
Mm-hmm.
But if any of the viewers would like some information on how they can go to these ACA websites and evaluate the performance for any disease condition for either the hospital they're going into or the home health agency that they want to take care of them. And it's always patient choice. The patient always has the choice on which home health agency they want to use. But if they would like more information on how to research this, I would recommend that they also, for this, they get in touch with Maddie at All County Healthcare as well.
Definitely. We mentioned the number at the beginning, but I'll just give it out again. Again, it's All County Healthcare Incorporated. You can talk to Maddie, like Edward said, and I have it right here. I didn't memorize it yet, but it's 954-717-7027. So that'd be very helpful. And like you said, there's ratings for hospitals, home health care agencies right on the ACA site as well. Now, I did want to talk to you a little bit about something you're really passionate about, the patient safety movement, based in Irvine, California, but obviously going on right here in South Florida. Tell me a little bit about it and how it can help our population.
Well, I became introduced to this organization in 2014, and it was after I had written a book. The title of the book is called A Free Kill, and it's a story about my son, my youngest son. He died tragically after an automobile accident, but he had been in a intensive care unit in a trauma hospital and showed steady improvement every day for 18 days. On the 19th day, he died of cardiopulmonary arrest, and he had normal, healthy heart and lungs. So something went terribly, terribly wrong. I wrote the book, to tell the story, hoping that, this could help prevent things like this from happening again. Someone from this organization, the Patient Safety Movement Foundation, became aware of the book, and they asked me if I would want to get involved with the organization. Now, this may be hard to believe, but anyone can Google this to see that it's true. Deaths, preventable hospital deaths, is the number 3 leading cause of death in the United States. Now, cancer and heart disease are 1 and 2. Lung disease had been number 3. But these accidental or preventable deaths in hospitals is now the 3rd leading cause of death in the United States. And another reason why, we're so passionate about our COPD program is because it helps keep people out of the hospital.
So hospitals are great to treat the ailment, but the goal is to get out of the hospital as quick as possible because of chance of infection, being in that environment where there's other sick people.
Medication errors.
Yeah, medication errors. I mean, we're all human. I mean, sometimes these doctors or nurses are working very long shifts. I'm not saying it's them, but it could be anything, a clerical error. But to just get out as quick as possible. Hospitals are great for getting people better, but get out as quick as possible. And we talked a little bit before we started the program about sepsis, which is
sepsis is one of the leading problems. People getting a blood infection while they're a patient in the hospital for a number of different reasons. We mentioned medication errors. The program that I am involved in, the committee that I participate in for the patient safety movement, is optimal resuscitation. different techniques to develop more effective resuscitations and preempting the need for resuscitation by recognizing a decline, early. Conservatively, by conservative estimates, there are about 200,000 deaths per year in the United States in hospitals that are preventable. Now, this is a huge number. So, why don't we hear more about it? If in the city of Coral Springs, for instance, where I live, if 570 people a day were dying, it wouldn't take long for it to gain national attention, would it?
No, not at all.
If 2 jumbo jets a day were crashing,
Mm-hmm.
it would not take long for it to get national attention.
No, it'd be the top story.
But in the United States, there are about 3,500 acute care hospitals. So that number, 200,000 divided by that number of hospitals, and I'm not saying it's an equal number, with all hospitals, but that's kind of the reason why it hasn't received more attention. News agencies have been doing more investigative reporting on this issue. And, this investigative reporting has done a lot to promote the cause of the patient safety movement.
Wait. It's not all fake news out there?
There is some.
I had to say that because, okay, there's good and bad in everything.
Mm-hmm.
But a lot of people know I am a reporter, and, most of us try to get the word out objectively. We went to school for this. So I just had to throw that in there, Ed, but go on. I didn't mean to.
Do the fact check.
No, always fact check everything. I mean, take the time to take a look. It's your life. Definitely.
Now, the other thing about the patient safety movement, what they're doing is they are looking to form an alliance amongst as many healthcare providers, as many hospital systems, as many teaching centers as possible to pool information, to pool research, to come up with plans, formulations to prevent these tragedies from happening. And, the patient safety movement, they operate internationally. I believe still that most of their activity is in the United States, but, they have international partners. And when they ask for a commitment, like from a physician group, a hospital group, whatever, it's not that they're asking for financial donations per se. They're asking for a commitment to participate. And I don't know too many organizations like that. All they're really looking for is to increase participation for the common goal of reducing the number of preventable deaths, through medical errors. In fact, their slogan is 0 by 2020. And they have a very, very aggressive goal to get the number of preventable deaths in hospitals in the United States down to 0 by the year 2020.
Wow, and I'm on the website right now. It's a great website. It's patientsafetymovement.org. And just like you said, Ed, 0 preventable deaths by 2020 is the headline right here. Patient Safety Movement. Great website, featured resources, challenges, and solutions. They even do a summit.
They have a summit every year.
It's called the 6th Annual World Patient Safety Science and Technology Summit. It's over in London, England, February 23rd through 25th next year.
Well, that's the World Summit.
The World Summit.
Yeah. Every year in California, in Irvine, they have a summit, usually in January. I participated in the 2015 summit.
Okay. Where was that?
No, it was in Irvine.
Okay, Irvine, California.
Yeah.
Lovely area. That's very timely in the news because the World Series starts tonight. So
There you
Dodgers and Astros should be interesting. Ed, I got to have you back on the program. It's just fascinating what you do as well to help people out, with these respiratory diseases. And like you said, to lower readmissions in the hospital. and you're very passionate about this. So thank you for coming on the program. I hope to have you on again.
Thank you. Thank
And
you, Dave.
if anyone has questions about ACA or any questions about home health care, like we said before, you can call All County Healthcare. Ask for Maddie, 954-717-7027. Thank you for joining You and Your Doctor. And listen on Friday, my show, How to Stay Healthy, 5:30 p.m. right here. Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station,